joins us. Good evening.
Thank you, Greta. Good to be back with you.
Nice to have you. Well, the Washington Post has a headline in an article saying, warning, ignore claims that 3.9 million people signed up for Medicaid because of Obamacare. Warning, that's a bad one. Warning to reporters that, in essence, that the numbers aren't quite what they say. Your thoughts on it?
I think if you think about it in reverse, you may find the truth in the pudding. One of the ways I look at it is if there was no Obamacare, how many of those same enrollees would have signed up? My understanding is that we would have about 300,000 or 400,000 more folks signed up, not 4 million or 5 million. So the fact of the matter is if I were in charge of having this health care roll out and there were 6 million Americans losing their coverage, more seeing their deductibles go up, millions more seeing their out-of-pocket expenses going up. I would not try to cook the numbers, but it certainly seems like people are looking for ways to make sure that there is a different approach taken.
You know, Senator Scott, I look at it even differently from everybody else. The Obama administration is you know, they're excited about 3.9 million. That number, of course, the Washington Post says it's not correct. But those are Medicaid. And what that means is those people don't have jobs. Medicaid means that the taxpayers will be supplementing. Now, it's good that they'll be able to have access to health care, but behind that 3.9 million are people who can't afford the living in poverty because our economy is so sluggish and there aren't jobs. So, you know, in some ways, it's rather shameful the bigger that number grows because that means that we are failing so much in getting this economy going and getting jobs. So I wouldn't be bragging about the big numbers if I were the Obama administration on Medicaid.
Absolutely not. As a matter of fact, one of the reasons why we are rolling out our opportunity agenda is because we recognize that there are 3 critical components for us solving the generational problem of poverty: family formation, education, and skills. So what we've decided to focus our attention on are ways for us to help people improve their incomes by improving their skills. And that's one of the key components of our Skills Act. The other thing we've recognized is that so many folks in the lowest end of the economic chain has the lowest level of education. So one of the goals that we have is helping people achieve academically so that they can help themselves achieve from an income standpoint.
And of course, you know, we've had a dismal jobs report in December, the most recent one we have. And so the people who have to go to Medicaid can't get jobs so that they could go to a different, so, you know, rise up a little bit in terms of, you know, perhaps getting a subsidy on and doing a partial payment on health care because there just aren't those jobs.
Well, when we celebrate 74,000 jobs created in a 30-day period of time, the worst number in 3 years, we really need to take a look at the numbers that are coming out of the government. And what I ask people to do is take a serious look at the impact of these low numbers, few jobs being created, more people not looking for work than finding work. We are in a very challenging situation in this country today.
Senator, thank you, sir.
Thanks.
And coming up.